Hi guys, it's Avery. This part of the presentation is on contraindications of contrast agents used in MRI. First, let's start with what contraindication means. A contraindication is a condition or factor that serves as a reason to withhold a certain medical treatment because of the harm it would cause the patient. Essentially, it means that surgery, drug, or a procedure should not be used because of the possible harm coming from it, due to a pre-existing patient's condition or factor. Contraindications are taken note of because it ensures safety of the patients. If a patient has a pre-existing condition that could affect the outcome of the use of a contrast agent, it is important to take note of that and not use that contrast agent. There are different contraindications for specific contrast agents used in MRI. However, this slide touches on some general contraindications that would be looked at before giving the patient the contrast agents. Some examples of these general contraindications are pregnancy, allergic reactions to the contrast, renal disease or deteriorating renal function, or no IV access. All of these examples could bring a red flag to the healthcare professional prior to giving the contrast agent. This could prevent serious issues in the patients that have or are or fall under any of these examples. MRI contrast agents are used to improve the visibility of body structures inside the body before the MRI is done. The contrast agent that is often used in MRI, as Kaylin talked about, is gadolinium contrast media. All of the contraindications talked about in the previous slide also apply for gadolinium contrast. However, the main contraindication that comes with gadolinium-based contrast agents specifically is severe acute or chronic renal failure, specifically with a glomerular filtration rate less than 30. This has a risk of nephrogenic systemic fibrosis, or NSF. NSF is rare but also a serious systemic disease. It is characterized by fibrosis of the skin as well as other tissue throughout the body. Avoiding this is a very important thing to do for all healthcare workers that are involved with that patient. That brings us to the end of my part of this presentation. Thanks for listening and learning about contraindications of MRI contrast agents.